A very good morning to all of you, and I'm really happy to be the part of this Harcon 2020. I have been the part of Harcon since the conferences have begun, thanks to Dr. Ravinder and the entire team. And it's really great to be part of this wonderful event. And one of the most important thing which I have to do before starting anything is that I congratulate Dr. Um, Ravinder for becoming the president of Haryana Chartered Association of Physiotherapy. Today, my topic is how to cope with the stages of grief after stroke. I hope I am audible and visible. Just a second. Am I audible? Please, if people will say anything. Actually, beginning for all those who have missed it. So now the topic of my presentation is how to cope with the 5 stages of stroke. Grief is one of the most important thing which has been neglected a lot, which we need to address before starting up our exercise therapy regime. Grief after stroke is a common emotional side effect that deserves careful attention, and this attention has to be addressed earliest. The reason why many stroke patients suffer from grief after stroke is due to the loss that accompanies stroke. And you know that after being unable to do some exercise or activities of daily living, these stroke patients may suffer from emotional setbacks and grief. And we need to know which stage of grief they are in. Is a natural reaction to the loss, and stroke survivors and their caregivers face loss every day because stroke patients don't cannot do the activities of daily living which they used to do prior to the stroke incident. The loss of former abilities or routine can be just as profound as a physical death. Understanding grief after stroke. To understand to understand grief after stroke, we need grief after can help to cope with the emotions. This grief occurs in 5 stages. First of all, the denial stage. After stroke has been treated, patients might have moments or even days of denial where he is or she is in denial that it happened. Mostly these patients cannot believe that this thing has happened to them, and it takes weeks together for them to believe that this thing has happened. Many stroke patients find themselves thinking, I never thought something like this would happen to me. This is the beginning of the grief. This can last for weeks. You need to address this denial. Dealing with denial. This stage is often fleeting. Usually, the passage of time is enough to help the people to cope with it. When you are socially interacted, you make the patient strokey to socially interact and to do the exercise therapy protocol, to visit the stroke centers, or to interact socially and to be among the people, among the society. This timely this denial will go off. Once he passes the shock of what just happened, he can begin or she can begin his recovery both mentally and physically. But you need to address it at the earliest. Now, anger. As Anger is one of the most commonly outcome of frustration. Common outcome of frustration. I have come across with many stroke patients during my work experience at National Stroke Association of Malaysia, where I come across and address this stroke many a times. So uh, I used to receive almost uh, 40 cases a day, in which we used to categorize the stroke patients into three categories: one, intermediate, advanced, and early stroke cases. Taking a detailed assessment will always help you mini-mental, or you can modify your assessment protocol so that you can see patient both physically as well as within himself, how he is, his behavior, his emotions and all, so that you can address him accordingly. But anger is mostly because when you keep a target to a patient, when he is not able to achieve it, he gets frustrated, and out of frustration there's anger. That's why we usually start with playway method, but it should be goal oriented exercise therapy protocol. The stroke recovery process is full of obstacles that he or she must overcome, and the frustration and injustice of these obstacles can often lead to anger. Now we need to deal with this anger. How to deal with this anger? If you can learn to view your obstacles as opportunities for growth, it can help you to cope with anger after stroke. When you are setting a targeted exercise therapy protocol for a patient, but you need to simultaneously address and psychologically counsel the patient for these exercises. For example, you will tell him that he is, for example, I'm taking a task of holding a ball and taking it up and down. Then you will tell the patient how to motivate the patient for this. Suppose you have to first tell him that today, if you are holding this ball, or maybe it may, you cannot catch it because of your weak muscles, but don't worry, as you try, keep on trying, one day you will hold it. But you need to keep on trying. If you are going to withdraw, so it's not going to help you. So you are going to motivate him for the exercises. If you are not motivating him for the exercises, if the obstacles are giving him the problem, so he will be frustrated of doing the activities, and out of this frustration he will be in a stage which is known as anger. While it can be hard to view recovery in a positive light sometimes, learn to look at it as a way to get stronger after stroke. So, if he is not able to achieve the target, so modify the things. If he is not able to do such holding a ball, so modify it, increase the circumference of the ball by applying tape or anything so that he can hold it. So you need to modify the things. And the third stage is bargaining. Bargaining occurs when patient starts making deal with a higher power through these two words: if then statement. For example, the strokey tells his therapist, if I do all my rehab exercise, then please let me get back to normal again. This phase that many people skip or perhaps experience second. It's common to experience the stage of grief out of order. So what happens? This this may be helpful. This may be helpful. Sorry, one second. Sorry. Dealing with the bargain is one step towards recovery, but it means that the patient is willing to do something. However, he is placing the his or her fate out of his control, and that won't lead to his highest recovery. For example, sometimes these bargaining like, so doctor, please give me some exercise, and after these exercise, can I do this thing? Can I do that thing? This is going to help sometimes, but if or she or he is going to put the faith in it, that it won't lead to the highest recovery, because they think that it is in their fate to be like this. Instead, realize that he is in control of his fate, and that he already has the power to achieve a full recovery after stroke. Now, the fourth one is depression. Like anger, post-stroke depression is a stage of grief that many stroke survivors will deal with. You will feel them very quiet because they are not able to do anything or something, and sometimes some things fall, items fall out of their hands, weak hands and all, and they get embarrassed in front of the family, in front of the society, so they keep themselves isolated. And this isolation is slow poisoning for stroke patients, because they need to be within the community. We have to hold their hand to introduce them to the society again, make them the part and parcel of the society again. And out, if they are depressed, take them to the parks, take them to the malls, take them to the cinema, take them to the zoo, take them to anywhere in the world, so that they will feel that they are part and parcel of the society, and this depression will not overshadow them. Depression can stem from neurochemical changes in the brain, and it can also be symptom of grief. Now, dealing with the depression, how to deal with this depression? Socially connected people are the most resilient. Although it's tempting to isolate yourself until your situation has improved, staying socially supported is extremely important. That's what I'm saying. Also, l- reading uplifting self-help books like Healing and Happiness After Stroke can help too. So give them books, good books, or interact with them, make them the part of the family. Don't keep them isolated within the room and let them for the mercy of God. No, you have to tell them, don't spoon feed them,